The Abhyanga is also very good for dryness,
Exactly.
for the dry
Mhm.
skin and so
Yes.
forth. And having good quality oils, that's good, useful in the diet. But in terms of vaginal dryness, I'm not in practice anymore, but what I used to suggest to patients, and they had very good results, was Shatavari ghee.
Okay.
Um, and it's a bit messy, but it's very useful. So,
Mhm.
using a little liner in the underwear or
Mhm.
something, and
Mhm.
or using it at night,
Mhm.
and having a little towel or something,
Mhm.
that can be really useful for that.
Okay.
And one thing about the Nadi Shodhana, the reason that that's useful is again based on this idea of duality of
Yes.
Brahmana and Langana, because the internal channel associated with the left nostril is called Ida, and that is associated in the body with the Brahmana, with Langana, with Brahmana, with the calming, nourishing, grounding aspect of things, the lunar aspect. And
Mhm.
Pingala is the inner channel associated with the right nostril, and that's more associated with Langana, with the light, hot, stimulating, motivating, dry thing.
Right.
And so when you activate both of those channels together in a very gentle way, they harmonize and they balance each other so that we don't have an excess of one or the other.
Mhm. Mhm. Okay. That's amazing. And so, and even for like joint muscle aches, because again, that can be something that starts to happen with the lightening of the bone. From my understanding, Abhyanga is a great practice for that.
Yes.
But also,
With that, maybe, if you've got joint and muscle pain, Mahanarayan oil
yes.
is useful to apply right on the joints. And,
Mhm.
this is why a little morning daily routine is so useful, is we can
Yes.
consider, what are my weak areas? What are the challenge areas? And again, we go to Sundhi, the joints, and the
Yes.
joints are that we start getting that joint pain. And
Mhm.
so using Banyan botanicals, and I don't get paid to say this, they have a preparation called joint balm,
Yes.
and that's fantastic.
Yes.
That's fantastic. It has castor oil in it and boswellia, which is frankincense. And
Mhm.
if you rub that a little bit into the joints and kind of, move the fingers around like this,
Mhm.
these
Mhm.
fingers, like all the little capillaries, stuff gets stuck in there. So,
Yes.
um, spending a little time in the morning in the daily routine part of our life on the bits that are going to be the challenge areas is helpful.
Mhm. Yes, absolutely. And then the last menopause symptom that I get asked a lot about, and this might be a longer discussion, but is, the weight gain, redistribution. And I know just the
Right.
dietary changes that we can make can help with that. Is there anything else
That
specifically?
Yes, there is something specifically, and again, I have to point people to the
Yes.
class,
Yes.
specifically on this. The online class talks about this a lot because
Hmm.
it doesn't make sense, right? Well, if we're getting drier, vata,
Right.
drier and lighter, and that's
Mhm.
langana, then why are we gaining weight? And
Yes.
the short answer is when stress goes on long enough, it affects the endocrine organs, all else being equal, in the following order. First, the adrenals, second, the insulin producing portion of the pancreas, and third, the thyroid. Think about how many people have thyroid things going on, and then
Yes.
ovaries and other things. But
Hmm.
when we look at that and we look at that insulin producing portion of the pancreas, that's where we end up getting that weight gain, that middle
Hmm.
weight gain. So you'd think that going out and jogging and jumping and being on a trampoline would take care of that. But sometimes slowing down and doing less takes care of that more, because we're addressing it's vata pushing kapha at that point. It's
Right.
not that you need to be moving more, it's needs you be moving less. um or
Right.
quieter kinds of movement. So that's one thing. But the other thing that I would say is I think that there's a natural um healthy tendency of the body to bring a little bit more weight for a while around menopause, because the first 5 years after menopause, there's a tremendous bone dump. We start
Hmm.
dumping bone faster than we've ever done it before.
Yes.
And if we have a little more weight on us during that period of time, that's not a bad thing, because
Hmm.
adipose is one of the one of the sources of estrogen after menopause. And
Mhm.
estrogen doesn't build bones, but it does have a protective
Protective.
effect,
Yes.
on too much osteoclastic activity, too much
Mhm.
bone breaking down activity. Um, so yeah.
Yeah, amazing. And then the last question I really would have is, as far as remedies go, what are some of the herbal remedies? And I know that you can't, prescribe anything, but if people are looking to see, what could they possibly use, and then they could ask an Ayurvedic practitioner and work with them, what would be some of those to think about?
Well, I put some of these things in the book.
Yep.
So, there's a long list. So I'll
Hmm.
leave that to the to the book for the most part. But
Okay.
I would say that it's really important not to read something on the web and think, oh, Shatavari is
Right.
good for women. I'll do that.
Yes.
It's just
Yeah.
absolutely got to be tailored to what's going
Yeah.
on with you. So, Shatavari is one of the most famous
Hmm.
women herbs,
Yes.
but I find it's a little estrogenic. And if
Hmm.
you have some kind of mass, something going on, masses,
Yep.
fibrocystic changes in the breast, any kind of
Yeah.
masses, heavy bleeding,
Hmm.
estrogen dominant kind of profile, you want to avoid Shatavari.
Yeah.
And if you don't, and you're underweight and really nervous and anxious, it could be perfect for you, but
Right.
really see somebody for the
Yes.
herb. That's the best thing for the
Yes.
herbal stuff. We'll have enough to do as
Right.
non-practitioners with the medicine of subtraction, seeing what in
Right.
our lives we can take away, changing our diets, doing that kind of thing.
Mhm.
Leave it to somebody who really has experience in this to
Yeah.
help, because they'll give you something, it'll work pretty well, but in 3 months you can meet with them again and they can tweak it, they can see what's going
Mhm.
on.
Mhm.
Follow up with them. Don't just get it and go, "Oh, it doesn't work."
Right.
Take it and then follow up with them 3 months later, 6 months later, every 3 months for a while, every seasonal change for a little while. What are the tweaks you can make?
Yes. And thank you so much for saying that. And I was hoping you would say that because I think there is this, ability to Google anything. You just look it up and it's Shatavari and everybody is like, okay, I'm going to take that. But I think what I'm so glad you said is that you really need to work with an Ayurvedic practitioner before you start those herbal remedies. And like you said, there's so many things you can do that are before the herbal remedies. So start with those.
Right,
And then if you're
right,
having a lot of difficulty, go to someone who can really guide you and help you with the herbal remedies. So I think that that's wonderful.